as you guys know, Atlanta is the headquarters of the CDC. Isn't that right, Robert?
Yeah, that's exactly right. And there is some, I want to say, tempered optimism here from medical officials as we're still waiting on the emergency use authorization request, which will be decided on Thursday. But here's a bellwether for you. Earlier this month, the United Kingdom approved Pfizer's vaccine, and that distribution is supposed to begin tomorrow. So when, should the FDA approve the emergency use authorization request for Pfizer's vaccine, medical officials say that they should start to see that distributed within a couple of days or so. Also, a little bit further down the line, you have Moderna's vaccine, which is that same emergency use authorization request. That's going to be looked at next week. And then, taking a look at a couple other companies that are down the line as well. There are a couple of other vaccines that are going through the stages of clinical trials at this moment, which there's a good amount of optimism around as well. But the timing, I guess you could say, is pretty pivotal here as certain parts of the nation really struggling right now. You look out at states such as California right now, and over 20 million Californians are looking as though that they're going to be spending the next couple of weeks in lockdown as cases are rising there. If you go out to New York, the governor just had a press conference earlier today saying that if their numbers don't get under control and they don't feel good about the hospitalization numbers and they see those start to get out of control, they could start to see restaurants shut down. They could start to see certain regions of the state go into lockdown mode. They haven't done it yet. They're keeping a very close eye on the numbers, but it's not off of the table yet. So, but with this caution to optimism coming from medical officials right now, they're telling us that if the emergency use authorization requests are approved for some of these vaccines, they could have several million doses of the vaccine available later this month. And again, that would be going towards healthcare workers and towards folks that are living in those long-term care facilities. And then go from there. But still a few more months to go in the pandemic is what they're saying. It still could be a few months until you start to see large numbers of the population vaccinated. But it's a starting point, shall we say.
And Robert, I don't know if you have any information on what's happening at the White House tomorrow with that vaccine summit. We know Moderna and Pfizer will not be in attendance, only because they have obviously matters before the FDA, before the regulators. Isn't that right?
Yeah, that's right. And that's information that Fox News was able to confirm earlier today, that the CEOs of Moderna and Pfizer, they were both offered invitations to go to the White House, but they will not be attending that summit. Other news coming out of the White House, though, we are expecting the president to sign an executive order tomorrow saying that Americans will be getting the vaccine first before they will be sending the vaccine overseas in order to help other nations, keeping in lockstep with the president's America First mindset. So we are expecting that to come out of the White House tomorrow, and we'll see what else comes out of that summit.
And Robert, obviously all the questions are surrounding supply. Remember, supply. We've heard from the CDC. They voted who can get the vaccine first. Here in Arizona, Governor Doug Ducey wants to put teachers on that list as well. So I guess it'll remain to be seen what states do when they get their allotments. But Robert, if you have anything else to add, feel free.
Yeah, I mean, I think it is important to remember that with the Pfizer vaccine and the Moderna vaccine, those both require two different injections. And that was something that the Department of Health and Human Services clarified earlier today, that while they have, I believe that they put the number at 40 million doses, you still need 2 doses per person. So that really drives the number down. Now, some of the vaccines that we are seeing that are going through the clinical trials process only require 1 injection, which could help things in the long term. But there is a finite number of vaccine that is going to be available. You really do have to make the decision as to who's going to be getting that first. So you look at states such as Florida. I mean, we've heard from medical officials there that one of their points of emphasis is going to be on those residents in long-term care facilities with such an elderly population living in Florida. And we are seeing, again, those two groups, healthcare workers, to trying to make sure that hospitals and such are not overwhelmed, but also protecting the elderly, and then starting to go from there.
And And just to wrap this up here, Robert, but the other side of the coin here is messaging. How does the U.S. government, how do state governments compel Americans to go and get the vaccine when it is readily available? We're seeing statewide efforts in some of these states, millions of dollars to, billboards, public service announcements. It's all going to be about messaging as well to try to get as many people to take this.
And the needle is moving, Andrew. We just see a study come out from the Pew Research Center, which said that about 60% of Americans surveyed right now have said that they would get the vaccine, which is 60% is not everybody, but it is an improvement from what we've seen before. And, talking to the Department of Health and Human Services, I mean, they continue to hammer home the message that they have not cut corners, according to their offices. They believe that they have gone through all the necessary steps. They've had to invest extra funds in order to get this through the processes more quickly, but corners have not been cut on this process. The way that they've been able to do this is they've been multitasking, shall we say, and that's where some of that extra money has come in, trying to get through a few of the tasks at the same time, as opposed to going one after another subsequently. So they do feel good about the safety of the vaccine. They understand that those concerns are out there, but they really are trying to hammer home that message of trying to bolster confidence in the vaccine, saying that this is state-of-the-art technology that is being used right now. We have seen multiple former presidents have said that they will be taking the vaccine again in order to drive up that optimism and confidence from the American public. So that is going to be one of the battles still that the Department of Health and Human Services has to continue to push forward on.
All right, Fox's Robert Sherman there for us in Atlanta. Thanks for joining News Now tonight. Have a good one.
Thank you, Andrew.
All right, and we're going to take it back out now to Pearl Harbor in Hawaii, where commemorations took place earlier today to mark the anniversary of the Pearl Harbor attack, the bombing by the Japanese. Especially on warships there in the bay, the USS Arizona, among the memorials there still standing. You can see the wreckage in the water of that battleship still to this day, 79 years later, where several hundred American sailors and Marines lost their lives. So we're going to go back to that right now.